Hey everybody, welcome to my channel. I'm Dr. Perkins, a board certified OBGYN, and today we're talking about the effects of preeclampsia on both the mother and baby. By the end of this video, you will know the signs and symptoms of preeclampsia. What does preeclampsia do to your system? How does preeclampsia affect the pregnancy? How to prevent preeclampsia? And the likelihood of getting preeclampsia in the future. Preeclampsia is a condition that can really adversely affect the pregnancy. And so it is important that we protect you as a mother and the baby as equally, because there's nothing better in pregnancy than having a healthy mom and a healthy baby. That is the goal. And so understanding preeclampsia is super important. And in this video, I've talked about how to know if you have preeclampsia, the diagnosis, as well as treatment options for preeclampsia. So go ahead and check that out so that you can get more information about this. Today, we will continue this conversation about preeclampsia by first addressing those who are most affected by preeclampsia, and that's Black women. It's important to make that note because as we think of maternal morbidity, which in the United States is quite high, it has been noted in most recent research studies that preeclampsia, hypertensive disorders in pregnancy, and maternal deaths and morbidity affects Black women 4 to 5 times as much as any other race. And making note of this is very important so that you can support each other. And if you are a Black woman, that you will also make note of the signs, the symptoms, and things that you can do to help decrease the likelihood of developing preeclampsia in pregnancy. So what are the signs and symptoms? In general, many people may experience preeclampsia without having any signs or any symptoms. In general, having high blood pressure is at baseline necessary to evaluate for preeclampsia and to be diagnosed with preeclampsia. Blood pressures greater than 140/90 would be the baseline of elevated blood pressures that would stimulate being tested further with lab work and evaluation of your urine. Preeclampsia is caused by the placenta. What we've known in the research and medical community is that the adherence of the placenta to the uterus, which is necessary, this is what brings the pregnancy life. This is what keeps your pregnancy healthy and stable. Sometimes in some people, that placenta is abnormally adhered or stuck or connected to the uterus, and this adherence can cause high blood pressures. So no, these blood pressures are not due to your lifestyle, your activities, your stress level, or even the salt and sodium in your food, as would be affected or as would be caused in people with chronic hypertension who's not pregnant. This is literally a placenta problem. And I'm very excited because as our research community continues to understand and try to understand preeclampsia, we now know that there is some benefit to using things like a baby aspirin to help to decrease the likelihood of getting preeclampsia. And so if you fall in these high-risk categories such as Black women or people with their first-time pregnancies, or if you're super young in your teenage years or older, advanced maternal age, females, you may benefit from taking aspirin, a smaller dose, 81 milligrams per day, or in other countries, 120 milligrams per day, to be able to decrease the likelihood of getting preeclampsia. Preeclampsia may affect both mom and baby in very different ways. And I like to talk about that in great detail today. For the mom, preeclampsia may put your life at risk. And that's because preeclampsia can actually lead to eclampsia, wherein you may have strokes and seizures, both of which can be either debilitating or can kill. With that, it's so important that we make the diagnosis very early on and treat as early as we can so we can prevent these things from happening. Preeclampsia can really be a scary condition that can cause a lot of stress. Everyone wants to have a healthy pregnancy. Everyone wants to have a healthy baby. And everyone also wants to transition through the stages of birth without having any complications. And so knowing that there is this potential potential of having pretty serious conditions because of this underlying placenta and blood pressure issue can really cause a lot of stress. And so if you're going through this process, I highly recommend that you talk with someone that you confide in about how you're feeling and what's happening internally. It's also helpful to have them be aware of things to look out for that you might not be noticing that may lead to preeclampsia. So for instance, if you're having a really bad headache and someone else very close to you knows that you're having a headache and knows that this headache is not improving, or they know that you're not feeling well, they might be able to get you the help that you need before that condition worsens to something greater. So talking to your family, having friends and loved ones who understands preeclampsia just as well and what to look out for may actually help to save your life as well. On the baby side, preeclampsia can be quite significant for them in that it may lead to a preterm birth, increases the likelihood of your baby needing support, a lot of support in the NICU, and sometimes, depending on how early and severe the preeclampsia is, sometimes babies may also not survive after having a preterm delivery. And so know that while you're having high blood pressures, if they're controlled, your baby is not being affected. If you're having other symptoms that are being controlled and monitored by your providers, your baby is usually in a stable state. Their greatest risk is preterm birth. And in that case, it is very important that you deliver your baby in an institution that has all the equipment and appropriate staff that would be necessary to help to support your baby after birth. And so knowing that you're getting treatment in a place that can really support your baby at whatever gestational age you may deliver is imperative to making sure that your baby survives and thrives. When does preeclampsia normally happen in pregnancy? Preeclampsia is only diagnosed after the 20th week of pregnancy. Once that diagnosis is made, it's very important that you have a conversation with your doctors about the long-term plan. If you're diagnosed between the weeks of 20 and 24 weeks of pregnancy, at that point, your pregnancy is considered to be pre-viable. That means that there's very little that we can do to help to support a newborn born within those 20th and 24th weeks. And so it would be very important that we try to keep you pregnant, because after 24 weeks of pregnancy, there's so many different interventions that we can actually apply to the newborn to help them survive and to help them do well. Babies do much better in the NICU the closer they are to being full term. And so the goal is to go way beyond 24 weeks and to aim to get to 37 weeks of pregnancy if possible. Now, if your life is at risk because your level of preeclampsia is quite severe, sometimes we would recommend delivery to save your life and to try to save your baby rather than put your life at risk. You may be wondering, well, what's the cure for preeclampsia? And I'm here to tell you today. While we can support your body and try to keep you pregnant, we can give you high blood pressure medicine. We can give you medicines to protect your brain, your blood vessels, your heart, your liver, and your kidney. The best cure is often to have you delivered. And this is because the placenta is the heart of the problem, and we need to have that placenta out. And there's absolutely no way for us to remove the placenta without delivering your baby first. Even if you've delivered your baby and you develop preeclampsia, the treatment options are still the same. Blood pressure support, as well as protecting your brain with magnesium sulfate if necessary. Outside of the postpartum period, which usually ends after the 6th week after delivering your baby, there are long-term effects that can impact your life in the future after having preeclampsia. And those include having chronic hypertension, meaning that outside of the postpartum period, outside of the pregnancy and delivering your baby, that you are at 3 to 4 times at a higher risk of developing high blood pressure that stays with you for life. There's a very small subset of people who may develop this chronic hypertension after preeclampsia. So even after delivering your baby, it is still very important that you follow up with your primary care doctors as well as your OBGYN to check your blood pressures and to be sure that there's no lingering effects from the preeclampsia. Now you may be wondering as well, how do I help my scenario if I had preeclampsia? What can I do to prevent it in the future? Know that the likelihood of developing preeclampsia again after having it the first time is quite high. I often say to my patients that if you did it before, you'll probably do it again. And so knowing this, it is important that you do things such as taking that baby aspirin, as I mentioned earlier in this video, and taking this as early as the first trimester of the next pregnancy, because research has shown that baby aspirin greatly reduces the chances of getting preeclampsia in that current pregnancy. And so if you fall in the high-risk categories, being Black, a first-time pregnancy, being really young or really old, advanced maternal age above 35, then you may want to consider taking baby aspirin even if this is your first pregnancy and you've not been diagnosed with preeclampsia, only to decrease the likelihood of it developing later on in pregnancy. Secondly, if you have underlying health issues, I highly recommend that before you go into pregnancy, that you control those health issues as best as possible. That means if you're obese or overweight, exercising, having a healthy lifestyle. That means that if you have chronic hypertension, that you want to take medications if necessary to keep your blood pressure at a baseline lower level so that you are not at increased risk of developing preeclampsia. But it also means that as you go for prenatal care in early pregnancy, that you are aware of what your blood pressures are like so that you can internally monitor what your body is doing, the trends that are going on, and to be sure that high blood pressure is not being missed as you go through your prenatal services. At all times, it is always important that you engage in these conversations with your doctor with every pregnancy. It's important because you want to be aware. You want your doctors to know that you're aware, but knowledge can be very powerful. When you have that conversation with your doctor, you will be able to advocate for yourself, to engage in that conversation, but to learn more about what your care has been like, what your trends have been like, so that you can get intervention and treatment if necessary. And earlier is always better than later. I hope you've enjoyed this conversation today. It's been a pleasure talking to you about preeclampsia and pregnancy issues as such. I have a free gift for you. I would love to share with you a free version of my book, Hormones Don't Lie. In this, we explore the hormones of the female reproductive system, wherein you can actually learn how to manipulate them and how to improve them so you can look and feel your best. Click the link below to get your free copy. I'm Dr. Perkins, a board-certified OBGYN, and as always, I enjoy, and it's been a pleasure to be here with you today. I'll see you next time.